Welcome to the Deep Dive, where we unpack critical skills that go beyond the purely clinical, delving into something just as vital for medical professionals: the art of the impactful presentation. You and I, we've all been there, haven't we? Sitting through a clinical presentation where genuinely vital information just gets lost in a cascade of text, leaving us sort of searching for clarity. But imagine for a moment transforming those experiences into truly dynamic encounters, inspiring your colleagues to swiftly adopt a groundbreaking new protocol, educating a patient and their family so they deeply understand and accept a complex treatment plan, or even securing that crucial, often elusive funding for your cutting-edge research.
Precisely. It's about shifting our mindset from simply transmitting data to, well, profoundly driving change and understanding. Our mission today is to take a deep dive into how you, our dedicated medical professionals, can profoundly elevate your presentation game. This isn't just about showing slides. It's about lighting a fire, creating that indelible spark that transforms audience perception and, crucially, action.
And guiding us through this essential exploration is a master of communication and synthesis. We're delighted to welcome Professor Mo Imam, whose insights will help us unpack the proven strategies for compelling content, polished delivery, and visual excellence. Thank you for sharing your expertise with us today.
Oh, it's a genuine pleasure. I'm really eager to share some actionable insights that can truly make a tangible difference in how medical professionals communicate, whether it's in a bustling theater, a quiet consultation room, or a demanding board meeting.
Fantastic. So let's kick things off with the absolute bedrock. When we talk about impactful medical presentations, it really starts, doesn't it, with defining your purpose and intimately understanding your audience for clinical impact. It's far more than just a simple data dump.
Oh, absolutely. The very first foundational pillar is to fundamentally shift your mindset from mere information transfer to embracing a genuinely transformative goal. Consider this. If you're presenting a new surgical protocol to your departmental team, your ultimate aim isn't just for them to know it exists, or even just to be vaguely aware of its steps. You want to move them from being completely unfamiliar with it to being genuinely motivated, equipped, and, well, eager to adopt that new protocol into their daily practice. That's a significant leap. Or, if you're speaking with a patient about a recent diagnosis, you're not just relaying a set of facts. You're guiding them from perhaps ignorance or even fear about their condition to being fully educated, empowered, and accepting of their treatment plan, understanding the why behind each step. The true aim in every medical presentation is transformation, not simply information delivery. You want to move your audience from point A to point B.
That's a profound and incredibly practical distinction, moving from unaware to motivated to adopt or ignorant to educated and accepting. So before you even consider opening PowerPoint or crafting a single slide, you're saying it's imperative to clearly define your why. What precisely do you want your audience to know, feel, and do after your presentation?
Precisely. This singular focus, this crystal clear why, should act as the guiding star for every single decision you make from that moment onwards. It impacts the content you choose to include and, crucially, what you choose to exclude, the tone you adopt, and even the precise manner in which you deliver your message. Whether you're preparing for a highly formal grand rounds, a competitive research symposium, or even a deeply personal one-on-one patient consultation, that why behind your talk is paramount. It's the ultimate filter. If a piece of information, a specific tone, or a particular visual doesn't directly serve that purpose, then it most likely doesn't belong in your presentation. It's a ruthless but necessary act of self-editing, really.
And that strategic lens of purpose leads us directly to cultivating what you call an audience-centric mindset. In the medical world, our audiences are incredibly diverse. You might be presenting highly complex research to specialist peers who speak your exact scientific language, or explaining the financial implications of a new drug to senior hospital management who are focused on budgets and ROI, or even simplifying a difficult diagnosis for a patient and their anxious family. How on earth do you tailor your content effectively across such a vast spectrum? It feels like speaking entirely different languages sometimes.
It genuinely can feel like that, yes, and it's a common stumbling block. You must relentlessly consider what your specific audience genuinely need and want to know, rather than merely what you can tell them or what you find most fascinating. A common, though understandable mistake we often make in medicine is to assume that everyone in the room shares our deep inherent passion for a specific subspecialty or research topic. The reality is they might be present out of sheer obligation, pure curiosity, or perhaps, it was simply the best sounding presentation of their options that day.
Right.
The real challenge, and where the greatest opportunity lies, is in identifying and connecting with those who are truly receptive and perhaps more importantly, those you explicitly need to win over. Tailoring your language, the level of detail you provide, the types of examples you use, ensuring they all resonate with their specific interests, their existing knowledge base, and their potential pain points is absolutely critical. Think about the differential diagnosis, but for your audience's needs.
I can certainly relate to sitting in a lecture where the speaker assumes everyone is as obsessed with their niche as they are. So it's about meeting them exactly where they are, acknowledging their motivations, even if it's just ticking a box. And when you're strategically preparing for any presentation, you advocate for what you call the 4 Ps. Could you break those down for us in a medical context?
Certainly. These 4 Ps are fundamental for truly strategic preparation, ensuring you're ready for, well, anything the environment throws at you. First, place. This is about meticulously preparing for the physical or virtual environment you'll be presenting in. Have you checked if the lecture theater has a functioning projector or if your virtual meeting platform supports interactive polls or breakout rooms for questions? Understanding the precise setting beforehand ensures you have all the necessary audiovisual aids ready, preventing those last-minute technical fiascos that can derail even the best prepared talk. Second, point. This means staying absolutely laser-focused on your core message, your single most critical takeaway. Avoid tangents, no matter how tempting they are or how interesting that related side research might be. If your primary point is to introduce a new, less invasive diagnostic tool for orthopedic injuries, then stick to that. Don't drift into the historical evolution of diagnostic imaging unless it directly serves and strengthens your immediate core point about the new tool. Every piece of information must earn its place.
And the other 2, which feel like they tie back to our earlier discussion of why.
Indeed, they build directly on that. Third is purpose, which, as we've discussed, is about what you definitively aim to achieve. Are you aiming to impart complex new anatomical knowledge to a group of registrars, compelling them to modify a surgical approach? Are you trying to persuade the trust board to fund a state-of-the-art new orthopedic theater wing, necessitating a clear ROI argument? Or are you gently reassuring an anxious patient about a complex, potentially daunting procedure? Your overarching purpose dictates your entire approach to content, tone, and delivery. And fourth, presentation type. It's crucial to categorize your talk. Is its primary goal to persuade or convince? Is it simply to inform or teach? Or is it a more ceremonial address, perhaps celebrating a departmental milestone? Each type inherently demands a distinct approach to content curation and, crucially, delivery style. Recognizing this classification from the outset helps you set precisely the right tone and structure, avoiding, for instance, a dry, informative lecture, when what's truly needed is a persuasive call to action.
That structural framework makes perfect sense. Once we have that crystal clear purpose and our audience firmly in mind, the next significant hurdle, especially with the inherently complex nature of medical topics, is structuring that information for optimal clarity and retention. And you often champion what you call the rule of 3. Why is that seemingly simple concept so profoundly powerful, especially for retaining complex medical information?
It truly is. The human brain, surprisingly, is inherently wired to process and retain information most effectively when it's presented in sets of 3. Whether you consciously break your entire presentation into 3 main distinct sections, focus intensely on 3 core memorable messages, or even use trios of words for emphasis and impact, think diagnose, treat, recover. This technique significantly enhances comprehension, recall, and ultimately retention. And here's the surprising truth for us in medicine. While we are meticulously trained to observe and account for every minute detail, that same exhaustive detail can actually impair recall in a group setting. Your audience isn't remembering 5 or 7 intricate points. They are neurologically hardwired to probably only retain 2 or 3 truly distinct bits of information at a time from a live presentation. The magic of 3 isn't just about elegant simplicity. It's about profoundly respecting the hard limits of human cognitive load in a high-information, often high-stakes environment like a lecture hall or ward round. So less truly is more, especially when lives might literally depend on remembering a core concept or critical alert.
That's a truly fascinating insight, that our training to be comprehensive can actually work against recall. It's almost like a narrative rhythm, isn't it? And speaking of narrative, you also suggest adopting the classic news bulletin approach.
That's right. It's the classic, tried and tested structure, often jokingly summarized as, tell them what you're going to tell them, then tell them what you told them. While it sounds simplistic, this 3-act narrative provides an incredibly clear, coherent framework that's particularly effective for intricate medical processes, detailed research findings, or even complex patient cases. By setting expectations up front, delivering the content, and then providing a concise summary, it keeps both you, the presenter, and your audience firmly on track. The audience knows what to expect, they absorb the information as it unfolds, and then they receive a reinforcing summary to consolidate that knowledge. This works brilliantly for presenting, say, a new multi-stage patient pathway for elective orthopedic surgery. You outline the stages, explain each in detail, then summarize the key benefits of the new pathway.
And for constructing those individual arguments or presenting complex case studies with robust evidence, you recommend the PEEL method. What exactly does that stand for, and how does it translate directly into a clinical context?
PEEL is an acronym that stands for Point, Explain, Evidence, and Link. It's an exceptionally robust and versatile method for constructing individual arguments, building a logical case, or meticulously presenting case study points. You begin with your clear point, your main assertion, your central idea. Then you explain that point in greater detail, providing necessary context and definitions. Next, you rigorously provide evidence to support your point. This could be compelling clinical data, peer-reviewed research findings, anonymized patient outcomes, or even a brief anonymized patient case vignette. Finally, and crucially, you link it back either to your overall presentation's core message, the broader clinical context, or to your call to action. This structured approach ensures not only deeper audience understanding, but also enhances engagement, compelling them to follow your logic, particularly when presenting research or clinical findings by firmly linking theoretical concepts to their practical, real-world examples. Imagine presenting a rare, complex orthopedic case where you use PEEL to explain your diagnostic approach. Point: early MRI for atypical pain. Explain: MRI provides high-resolution soft tissue visualization. Evidence: illustrate with anonymized patient MRI showing subtle tumor. Link: early detection facilitated timely intervention, significantly improving prognosis.
That provides such a clear, almost undeniable framework for presenting evidence-based information. And displaying a clear outline at the start of a presentation also seems incredibly beneficial, almost like a consultation roadmap.
It is invaluable, truly. A clear outline, or a map, at the very beginning provides your audience with a concise preview of the topics you'll cover and, crucially, how they interrelate. Even with the most complex medical information, subtly displaying a simplified version of this outline throughout your presentation, perhaps as a small navigation bar in a corner of your slides, or a visual progress indicator, can profoundly help maintain audience orientation. They always know exactly where they are in your argument, preventing that disoriented feeling of being lost in a sea of new information. It's like providing signposts on a winding road.
But even with all that structure and mapping, you still advocate for extreme simplicity, even for highly educated medical audiences. Why is that? Surely a room full of consultants can handle more granular detail.
This is one of the most counterintuitive yet critical pieces of advice. The human brain, despite its incredible complexity, has a remarkably finite capacity for retaining truly new information in a group setting. In a live presentation, whether it's a bustling lecture hall or a focused departmental meeting, most people can only effectively recall 2 to 3 distinct bits of information at a time. Therefore, the absolute goal is not to describe every single detail, every nuanced finding, or every methodological step. If you attempt to cram too much in, it almost always results in what's colloquially known as death by PowerPoint, or, as I like to call it, death by fire hose, an overwhelming torrent of information that washes over the audience without sticking. Your real strategic purpose is to pique enough interest to compel others who share your specific interest to strike up one-on-one conversations after your presentation. The talk itself is the appetizer, not the main course. It's about lighting that initial spark, making them want to delve deeper into your work rather than trying to make them instant experts in 10 minutes. No presentation, even a highly technical one, should honestly have more than 3 main points. 2 is even better. It forces clarity and prioritization.
That's a truly fascinating perspective, framing the presentation as an invitation for further discussion rather than a comprehensive lecture. And to achieve that, you're a big proponent of Guy Kawasaki's 1-0-20-30 rule. Tell us more about how that applies to, say, a surgical review meeting.
It's a fantastic, almost revolutionary guideline for anyone in a professional setting. The 1-20-30 rule states, no more than 10 slides for your entire presentation, a maximum of 20 minutes for your actual talk, and a minimum 30-point font size on your slides. The profound essence of this rule is that your slides should serve as a dynamic sideshow to you, the presenter, of visual reinforcement, not the primary source of information. They should contain minimal information, presented simply, visually compelling. Any more detailed material, the dense data, the extensive methodologies, should be available in handouts for those who want to delve deeper after your presentation. This approach actively prevents the dreaded death by PowerPoint, ensuring the audience is genuinely listening to and engaging with you and your message, rather than silently reading paragraphs off a screen. Think about a surgical review meeting where you're presenting a post-op complication. You don't need 30 slides of every single metric. You need 5-7 clear slides. The patient history, the key surgical steps, the complication, your proposed solution, and the lessons learned. And that 30-point font, it forces you to be concise. If you can't fit it in a large font, it's too much. It challenges the medical instinct to include everything.
So we've laid the groundwork with defining purpose, understanding our audience, and structuring information for maximum retention. Now let's talk about the beating heart of the message itself, crafting truly compelling content. And central to this, you argue, is harnessing the inherent power of storytelling within clinical narratives. You say our brains are wired for stories. What's the science behind that, beyond just making things interesting?
The power of storytelling is rooted deeply and physiologically in our neurology. When we hear a well-crafted story, our brains don't just passively absorb information. They release oxytocin, a neurochemical hormone strongly associated with empathy, trust, and connection. This fosters a profound emotional bond between the storyteller, you, and your audience. This emotional engagement makes complex medical ideas, intricate pathways, or even dry data sets much more relatable, more memorable, and ultimately more actionable. Stories bypass the purely cognitive filter and tap into our shared human experience. They transform what might otherwise feel like tedious drudgery into captivating drama. This isn't just about making it entertaining, it's about making it stick in inspiring action.
So instead of simply presenting, say, statistics on patient demographics for a specific orthopedic condition, you're suggesting weaving in a brief, anonymized patient's journey to illustrate a key point. Give us an example of how that might sound.
Precisely. Imagine you're discussing the rising prevalence of a particular joint infection. Instead of a slide full of percentages, you could open with, meet Arthur, a retired builder, 72, who came to us with what seemed like a straightforward knee replacement. But 3 months post-op, a persistent fever and swelling emerged. We quickly diagnosed Staphylococcus aureus infection. Arthur's journey, from his initial hope to the challenges of prolonged antibiotic therapy and revision surgery, vividly illustrates not just the statistics we're about to review, but the human cost of this challenge. This brief, anonymized narrative illustrates a key point about a specific condition or treatment pathway in a way that raw, dry data never could. Elements of surprise, a touch of appropriate humor, or even a hint of tension where it truly serves the narrative can elevate the entire experience and make those facts emotionally resonant. It's about embedding your critical facts and figures within an engaging human narrative to make them unforgettable.
That's incredibly powerful, making the data breathe. And are there specific story structures that translate particularly well into medical context? You mentioned SCQA, Story Mountain, and even the hero's journey. How can a medical professional practically apply these?
Yes, these frameworks are incredibly versatile and can elevate almost any medical presentation. The SCQA, Situation, Complication, Question, Answer framework, for instance, is perfect for structuring a technical update or even presenting a challenging patient case. Imagine you're explaining the diagnosis and management of a rare pediatric orthopedic disease to a multidisciplinary team. Situation. We're seeing a 7-year-old patient presenting with progressive limb length discrepancy and unusual gait disturbance, atypical for common pediatric conditions. Complication. Initial radiographic findings were inconclusive, standard inflammatory markers were negative, and the family history provided no clear genetic links, complicating immediate diagnosis. Question. Given these confounding factors, how do we accurately diagnose this condition early? And what is the optimal evidence-based treatment pathway for long-term functional outcome? Answer. Through advanced genetic sequencing and a collaborative consultation with international experts, we identified a novel gene mutation, leading to a tailored, multi-stage surgical correction plan combined with targeted physical therapy. This framework quickly simplifies complex jargon into relatable scenarios, providing a clear pathway of understanding.
That's very clear, turning a complex diagnostic puzzle into a compelling mini-narrative. What about the Story Mountain for a project or case study?
The Story Mountain is a fantastic visual metaphor for mapping the journey of a complex project, a long-term research study, or an extended patient case. You start with an opening, perhaps setting the scene for a particularly challenging orthopedic trauma case. Then you build through the build-up, detailing the diagnostic process, the debates around treatment planning, perhaps the complexities of preoperative stabilization. You then ascend to the climax. This is the pivotal moment, the critical surgical decision, the high-stakes intervention, or the breakthrough finding in your research. This climax then resolves in the resolution, detailing the successful patient outcome, the recovery phase, or the key results of your study. Finally, you conclude with an ending, highlighting the long-term patient impact, the lessons learned, and the broader implications for clinical practice or future research. It provides a clear, emotional, and logical arc that audiences naturally follow.
And for those larger, more ambitious talks, like keynote speeches at a major conference or perhaps a groundbreaking research proposal seeking significant funding, the hero's journey comes into play.
Indeed. The hero's journey is a longer-form narrative framework that, while grand, can profoundly captivate an audience over an extended period. It provides a universal, deeply resonant arc. It might start with the call to adventure, identifying a significant unmet clinical need or a profound research question that demands addressing. Then comes resisting the call, representing initial funding challenges, ethical hurdles, or even internal departmental skepticism. Meeting the mentor could be collaborating with a senior, experienced researcher or securing crucial external expertise. The abyss involves major research setbacks, unexpected trial results, or significant surgical complications that threaten the entire endeavor. The reward is the breakthrough findings, the successful patient outcome against the odds, or the novel treatment protocol. And finally, the return signifies applying this new knowledge to benefit others, scaling up the intervention, or disseminating new guidelines to a wider community, demonstrating how the hero's journey has now benefited many. It adds a powerful, relatable, and deeply human arc to even the most complex medical endeavors.
These structures provide such a powerful way to frame clinical information, making it resonate beyond just facts. But beyond these grand narratives, what about more practical techniques for engaging medical audiences in more day-to-day, perhaps less formal settings?
One incredibly effective technique, particularly for training or orientation sessions for new medical staff, is to introduce an ideal persona. Instead of simply listing objectives and key performance indicators, you create a compelling narrative around an exemplary junior doctor or an ideal ward nurse. You describe their journey, how they overcome common challenges, embody best practices, and achieve key results. For instance, Dr. Emily, a new F1, initially struggled with complex discharge summaries, but by consistently applying the new digital tool and seeking senior feedback, she now completes them flawlessly, improving patient flow and reducing readmissions. This inspires commitment to objectives by illustrating them through a relatable character's successful journey, far more engaging than a dry bullet point list.
And for sales meetings, say, pitching a cutting-edge new medical device or software to a hospital procurement team.
For sales meetings in the medical tech space, thorough research on your specific client is absolutely paramount, whether they're hospital administrators focused on cost, procurement leads obsessed with efficiency, or clinicians concerned with patient outcomes and workflow. You must tailor your stories, analogies, and metaphors to their specific interests, their expected return on investment, and their risk thresholds. The absolute focus should always be on how your solution directly addresses their most pressing pain points. Don't just list features of your new surgical robot. Tell them how it specifically solves their challenge of lengthy recovery times, reduced theater efficiency, or staff training overhead. Demonstrate through a compelling story how the robot improved another hospital's patient throughput by 20%, leading to a direct financial gain and improved patient satisfaction.
That makes a lot of sense, focusing on their problems, not just your product, and carefully repurposed patient testimonials can also be an incredibly powerful tool, I imagine.
They absolutely can, but with careful consideration for anonymity and consent. Anonymized patient stories, ethically gathered from patient satisfaction teams or through research, are incredibly powerful. They can act as an invaluable feedback loop, revealing subtle product or service flaws, informing the development of new clinical guidelines, or serving as powerfully emotive punchlines when introducing new initiatives. Imagine you're proposing a new patient pathway for chronic pain management. Instead of just presenting data on reduced clinic visits, you could conclude with, "Why did we create this complex new pathway? Because of stories like this. Before, I felt my pain was just a number. Now, with the new integrated pain service, I finally feel heard and I'm living again." That emotional connection automatically validates your efforts and resonates deeply with any audience focused on patient well-being.
That's a profound way to connect. Finally, how do we subtly encourage a formal presentation to transform into more of a genuine dialogue, even with a larger group of medical professionals?
The key is to consciously simplify your language, ruthlessly avoiding unnecessary medical jargon, or, crucially, explaining it clearly and concisely when it's absolutely essential. Structure your narrative to encourage a back and forth rather than a monolithic monologue. Have relevant, compelling case studies or anonymized patient scenarios ready as examples, prepared to illustrate your points and invite questions. Be adaptable to audience questions or even mini monologues from them. Don't interrupt too quickly. Let the conversation breathe. And crucially, push your absolute key points early on so you can reference them later as the discussion evolves. The goal is for it to feel like an intimate, impactful one-on-one conversation, even if you're addressing 100 people in an auditorium. It draws them in and makes them feel like active participants, not just passive recipients.
That's brilliant. Moving from the compelling content to the impactful delivery, the precise language and messaging we choose are critical for clinical clarity. You talk about presenting information in snackable bites. What does that mean in practice for, say, a busy ward round briefing?
Spoken language, especially in high-pressure or information-dense settings like a ward round, is most effective when delivered in short, simple words and concise phrases. The golden rule is ideally one distinct idea per phrase. This approach actively prevents cognitive overload, which is particularly vital when you're discussing complex medical concepts, patient updates, or urgent actions. Avoid lengthy, convoluted sentences or multiple subclauses that force your listener to mentally untangle your meaning. Break them down. For instance, instead of saying, "The patient, a 68-year-old male with a history of hypertension and diabetes who underwent a total hip arthroplasty last Tuesday, is now experiencing acute postoperative febrile episodes requiring immediate investigation for potential surgical site infection." Simplify it. Mr. Smith, 68, post-hip replacement, fever, rule out surgical site infection, needs urgent bloods and wound check. This ensures your audience can easily digest and retain the critical information, even under pressure.
And using personal pronouns like I, we, us, and you. How does that subtle shift enhance connection and the feeling of shared responsibility during, say, a team meeting?
It's a surprisingly powerful psychological lever. You'll find that consciously using these personal pronouns makes your words far more compelling and immediate. When you say you or we, you're speaking directly to your audience, creating a personal connection to the message and fostering a sense of shared ownership or collective responsibility. This technique works wonderfully in a ward-round discussion, a departmental meeting, or even when discussing a new clinical guideline. For instance, instead of "the protocol states patients should mobilize," try, "we need to ensure our patients mobilize promptly." Or, "you will find this new charting system significantly more intuitive." It draws them in, making your words feel more relevant and immediate to each individual listener, as if you're speaking only to them.
You also advise against what you call meta talk. What exactly is that in a medical presentation context, and why should we actively avoid it?
Meta talk is essentially narrating the mechanics of your own presentation. It's saying things like, "In this presentation, I will now show you the data from our latest trial," or "I'm now going to take you through this next slide, which outlines our findings." Right. Think about a normal, fluid conversation. You would never say, "In this sentence, I am now saying the words." It sounds incredibly artificial and immediately creates a psychological distance between you and your audience. Instead, cultivate the habit of speaking to your audience as if it's an authentic, one-on-one conversation, regardless of the group size. This approach builds rapport, makes them feel genuinely engaged, and allows your true excitement and passion for your message to shine through unhindered. The slide or visual aid should simply support your spoken word, acting as an illustration, not something that requires its own narrative introduction. So, now turn to page 3. Here are the quarterly sales figures as shown on the presentation. Exactly. Instead, you'd simply state the information directly and confidently. For example, our latest patient satisfaction scores are up 3% this quarter, a significant improvement. This means we've now been consistently increasing positive patient feedback for the last 6 quarters, a trend we're incredibly proud of and are committed to continuing. The audience receives the crucial information directly and powerfully from you, the expert, and the visual on the slide then simply reinforces it, acting as a clear, concise data point. It's a subtle but profoundly impactful difference in how effectively you communicate and how credible you appear.
That immediately sounds more engaging and authoritative. What about the headlines we use on our slides, especially for medical research or clinical updates? How can we make those truly meaningful and informative?
Your headlines should be short, impeccably clear, and genuinely informative, acting as miniature summaries of the slide's core message. For instance, a headline like, "New antibiotic reduces surgical site infection rate by 15% in orthopedic patients," is immeasurably more effective than a vague or generic title such as research findings or outcome data. Truly informative headlines allow your audience to quickly grasp the main point of a slide at a glance, even as they are simultaneously listening to your detailed explanation. It's a powerful aid to comprehension, helping them to effortlessly follow your narrative without having to strain to understand the slide's purpose or mentally piece together its relevance.
And the dreaded filler words, the like so, you knows. How do we effectively eliminate those to sound more polished and professional, especially in high-stakes medical discussions?
Filler words can be an absolute professional Achilles heel. They can severely undermine your professionalism, distract your audience, and subtly erode your credibility. Practical strategies include religiously practicing aloud, perhaps even recording yourself and listening back critically to identify your personal habits. Once you recognize them, consciously embrace moments of purposeful silence. It might feel profoundly uncomfortable at first because we naturally want to fill conversational space, but strategic pauses are an incredibly powerful communication tool. They allow both you and your audience to process information. A particularly pervasive filler in technical and medical circles is so. It can be overused to the point of sounding patronizing, implying that the audience hasn't grasped a simple concept. Consciously replacing or eliminating these verbal tics will make a truly monumental difference to your perceived professionalism and the clarity of your message.
That's a powerful self-assessment technique. And when presenting to high-level executive audiences, think hospital boards, trust committees, or major research funders, what critical shifts in language and messaging are absolutely crucial given their intensely limited time?
For executive audiences in healthcare, understand this. Their time is arguably their most precious and most limited commodity. Your message must be ruthlessly streamlined, focusing almost exclusively on the dollars, not just financial, but the measurable business impact, the patient outcomes, the efficiency gains, or the cost savings. You must highlight the direct relevance to overarching organizational goals, present clear, actionable recommendations, and make explicit, specific requests. The language you use should be less tentative, less academic, and far more direct, unequivocally stating impacts and recommendations. For example, instead of "our preliminary data suggests a potential for improved patient flow," state, "our new pathway reduced emergency department wait times by 25%, resulting in an estimated annual saving of 6 pounds and directly impacting patient satisfaction scores." They want the outcome, the bottom line first, and only then the bare essential details on how you arrived there.
Right, less in the weeds and more, what's the tangible benefit to our organization?
Precisely. To that point, always have a meticulously prepared appendix of more detailed information supporting data and granular methodology ready at hand. This allows you to confidently state, "Oh yes, I've looked into that extensively, and the detailed breakdown is available in the appendix," if a senior leader asks a probing question. This demonstrates thoroughness without cluttering your main high-level presentation. A subtle but effective tip is to observe and, where appropriate, subtly incorporate the common phrases or even the specific slang used by senior leadership within your specific organization or industry. This subtly signals that you are in the same group, that you understand their strategic priorities and lexicon, which significantly enhances connection and credibility. Researching their specific technical backgrounds or strategic interests before you present can also profoundly inform your entire approach.
That's a clever, almost anthropological tip for building rapport. Now, let's pivot to perhaps the most immediately visible aspect of presentations. Designing visuals for maximum impact, especially in a medical context. It's not just about aesthetics, is it? There's a true science to visual retention.
Absolutely not. It's far from mere decoration. The science is unequivocal. Research consistently demonstrates that people remember an astonishing 80% of what they see and do, compared to a mere 10% of what they hear and 20% of what they read. Furthermore, information that is presented visually and orally, that is, a compelling presenter speaking to a strong visual, is retained 6 times longer than information presented orally alone. This highlights the utterly critical, indispensable role of visuals in medical communication, whether you're educating patients on complex anatomical concepts, illustrating intricate surgical procedures to surgical residents, or presenting dense epidemiological data to policymakers. Our brains are simply hardwired for visual processing.
And color itself plays a significant psychological role in this retention.
Indeed. Color isn't just an aesthetic choice. It significantly influences perception, mood, and critically engagement. Studies show that the strategic use of color can increase a person's willingness to read by 80% and can positively affect motivation and participation to the same remarkable degree. Even more notably, color can account for up to 60% of an object's acceptance or rejection, which means it's an incredibly powerful, yet frequently underutilized or misused, tool in slide design for medical and scientific content. A calming blue might be appropriate for a patient education slide, whereas a stark red might highlight an urgent alert on a dashboard. It's about being intentional.
So visuals are truly a second powerful layer of understanding, not just a supportive embellishment.
Exactly. They do far more than merely illustrate your words. They actively stimulate the visual channel of the brain, providing an additional parallel pathway to understanding and knowledge retention. When you're attempting to explain something as intricate as the molecular mechanisms of a new pharmacological agent or the precise multi-stage progression of a particular disease, this second, deeply impactful layer of visual information can make all the difference in achieving profound comprehension and lasting recall. It allows the audience to see what you're describing, creating a deeper imprint.
That makes the shift from traditional text-heavy slides to genuinely visual-centric ones even more compelling. What are your absolute key principles for effective slide design, specifically tailored for medical content?
First and foremost, you must be utterly ruthless about ditching excessive text. Slides that are overloaded with dense paragraphs or bullet points act not as aids, but as severe visual hindrances. The fundamental principle is that your audience should be actively listening to you, the expert, not silently reading your slides. Encourage, no, demand, the predominant use of impactful images, diagrams, and other visuals over sprawling blocks of text. If you can explain it with a picture, do so. If you have to use words, make them count.
And you have a very specific rule for conciseness that helps with that, the 5 eye sweeps rule.
Yes, this is a pragmatic guideline for optimal processing. The rule states no more than 5 eye sweeps per slide, meaning your audience shouldn't have to scan more than 5 distinct areas on a single slide to grasp its core message. In practical terms, this translates to incredibly concise bullets, ideally no more than 5 words per bullet point or title, and a strict, absolute avoidance of large, overwhelming blocks of text. The logic is simple. If the audience has to work hard to read your slide, their cognitive bandwidth is consumed by deciphering text, and they are, by definition, not listening to you. Ideally, your slide should be so clear and instantly comprehensible that someone could absorb its core message simply by glancing at it while driving past it at 70 miles an hour.
That's a wonderfully vivid and memorable analogy. Font choices are also crucial, particularly for readability across different screen sizes or room setups, from a large lecture hall to a small screen in a virtual meeting.
Definitely. Prioritize clarity and legibility above all else. Always use sans serif fonts like Arial, Calibri, or Helvetica at a minimum of 30 points for easy legibility, even from the back of a large auditorium or on a small mobile device. It's also important to remember that lowercase text is generally quicker and easier to read than uppercase, and you should staunchly avoid fonts designed primarily for print, such as Times New Roman, which can become incredibly difficult to read when projected onto a screen or viewed digitally. Your fonts should be clean, crisp, and immediately understandable.
And contrast is non-negotiable for clarity, I imagine.
Non-negotiable is the perfect term. High contrast between your text and background colors is absolutely critical for clear legibility. Dark text on light backgrounds, or conversely, light text on dark backgrounds, consistently provides the clearest and least fatiguing reading experience. I also strongly recommend maintaining a single, muted background color, think soft beige, a subtle gray, or a calm off-white, consistently throughout your entire presentation for visual cohesion. Avoid busy, loud, or patterned backgrounds that compete with your content for attention. Your background should be like a stage, not a chaotic theater.
So simplicity and consistency, even in visual design, and when it comes to curating those powerful visual elements themselves, the actual images and graphics.
This is where you can truly differentiate your presentation. Emphasize the use of relevant, high-quality images, carefully crafted infographics, and clear illustrations. If you must use stock photos, ensure they look authentic and relatable, not generic, staged, or obviously stock. Infographics are superb for synthesizing complex medical data, statistics, or patient demographics into an easy-to-digest graphical format that communicates instantly. Custom illustrations, when possible, should meaningfully contribute to your narrative and avoid bland, overused clip art. Every visual must earn its place. If it's not actively helping people learn, remember, or understand, then it needs to be ruthlessly removed from the slide.
Are there any specific medical visual examples that truly stand out as effective?
Absolutely. For radiological images like X-rays, CT scans, or MRIs, always place them on black backgrounds. This significantly enhances the clarity and contrast of the image itself. Then, use clear, high-contrast arrows or circles to direct the audience's eye immediately to the pathology or the specific area of interest, rather than allowing them to be distracted by the surrounding noise of the image. Another incredibly powerful technique is strategically replacing text with pictures or icons, for example, using country flags instead of writing out long country names for epidemiological data, or simple, universally recognized icons for different types of surgical instruments. This conveys universal concepts rapidly and significantly enhances memory.
And what about that final slide? So many people just stick a thank you with a random picture.
This is a wasted opportunity. Absolutely avoid generic thank you slides paired with irrelevant, often cliched stock pictures. Your final slide should be a powerful summary that crystallizes your core message and, crucially, includes a clear, actionable call to action, leaving the audience motivated and knowing precisely what you want them to do next. You can and should always offer a sincere thank you verbally, but the slide itself should remain purposeful, serving as the lasting impression, the final, impactful punctuation mark of your presentation. Perhaps it's your contact details for follow-up questions, or a link to a resource, or a single, powerful statement.
That's a practical and incredibly impactful shift, turning the end into a new beginning. You also suggest leveraging visual metaphors to clarify complex medical concepts without confusion. Can you give us some truly illustrative examples from the medical field?
Certainly. Visual metaphors are incredibly potent for simplifying abstract or complex medical concepts, allowing for instant recognition and deeper understanding. Imagine illustrating inefficiencies in a patient flow pathway or resource allocation within a busy hospital department. Instead of a flow chart, a bottleneck image, perhaps depicting a traffic jam or a narrow opening in a pipe, can vividly convey where delays are occurring and why. To represent a gap analysis in current treatment protocols, say for a chronic disease where new research is needed, you could use an image of a broken road over a crevasse. This instantly communicates what's missing and the challenge of bridging that gap. When proposing a new solution that isn't quite fitting the current healthcare system's established needs or culture, the classic square peg in a round hole metaphor visually communicates the misalignment without needing lengthy explanation. And for visualizing patient recruitment in clinical trials or conversion rates in health campaigns, the iconic funnel is universally understood. It instantly illustrates the process of narrowing down a large pool to a specific target, or the progression from initial awareness to final participation. These metaphors simplify complex ideas instantly, making them stick.
These visual techniques truly bridge the gap between abstract concepts and rapid audience understanding. Beyond foundational design principles, what hidden or underutilized PowerPoint features can medical professionals leverage to significantly enhance the professionalism and engagement of their presentations?
PowerPoint, despite its ubiquitous use, harbors some incredibly powerful features that many presenters, even experienced ones, often overlook. The morph transition, for instance, is absolutely fantastic for creating seamless, dynamic animations between slides. Imagine illustrating the precise, step-by-step progression of a disease over time, from cellular changes to macroscopic symptoms, or meticulously detailing the stages of a new, minimally invasive surgical procedure. Instead of jarring jump cuts or static slides that disorient your audience, Morph allows you to smoothly transition from a broad anatomical view to a microscopic cellular interaction, or from the initial incision to the final closure, making complex processes incredibly intuitive and memorable for your colleagues and students.
That sounds like it could really enhance surgical teaching and for navigating complex research data.
Precisely. Zoom for PowerPoint allows for incredibly flexible, non-linear navigation. This is perfect for complex research presentations or patient cases where you might need to jump between different sections or levels of detail without having to click through every slide in sequence. You can create an interactive summary slide that links to various sections, allowing you to fluidly respond to audience questions by instantly jumping to the relevant data or to explore a specific topic in depth before returning to your main flow. It makes your presentation feel dynamic and responsive rather than rigidly sequential.
And for aesthetic improvements, especially for those of us who aren't graphic designers.
The designer tool in PowerPoint is an absolute game changer. As you add content to your slides, be it text, images, or data, it automatically suggests intelligent layout ideas that significantly improve readability and overall aesthetics. This is incredibly useful when time is scarce, allowing you to instantly elevate the visual appeal of your slides without needing advanced design skills. You can also directly insert icons and 3D models from PowerPoint's vast built-in library, which can profoundly enhance medical slides with accurate anatomical structures, detailed surgical instruments, or scientific diagrams, providing rich visual context without leaving the program.
How can presenters ensure consistent branding and design across their entire presentation, especially within a large department or a collaborative research group?
The Slide Master feature is absolutely essential for this. By meticulously setting up a Slide Master, you ensure consistent design elements, fonts, color palettes, corporate logos, and standard layouts across every single slide in an entire presentation. This is vital for maintaining professional branding for a hospital department, a research group, or even an entire trust, ensuring a polished, cohesive, and instantly recognizable look. It's about building a consistent visual identity. Lastly, the Record Slideshow feature is an invaluable tool for remote presentations, asynchronous learning modules, or for sharing talks with colleagues who couldn't attend live. It allows you to record your narration, precise slide timings, and even pointer movements, creating a self-contained, high-quality teaching module or a comprehensive presentation that can be reviewed at any time.
That's a truly comprehensive toolkit. Are there any automation tools that can further boost efficiency in slide creation, particularly for the often complex charts and graphs so common in medical data?
Absolutely. For anyone routinely creating charts and graphs, specialized PowerPoint add-ins like ThinkCell can significantly reduce the time spent building these elements, potentially saving up to 70% of that effort. This isn't just about speed. It boasts capabilities for creating over 40 distinct chart types, from waterfall charts crucial for financial analyses in healthcare to Gantt charts for project timelines, and it ensures error-free, visually consistent, and on-brand outputs. This level of automation means you can focus far more of your precious time on interpreting your insights and crafting your narrative, rather than on the tedious mechanics of chart creation and formatting. It's an investment that pays dividends in accuracy and time savings.
So building a reusable slide arsenal sounds like a smart, long-term strategy for efficiency and consistent quality, particularly for busy medical professionals.
It definitely is, and I cannot overstate its value. Maintaining a meticulously well-organized library of standardized templates, dedicated section slides, frequently used icons, trust logos, high-quality images, and pre-formatted graphs promotes immense efficiency and consistency across all your presentations. This reusable slide arsenal allows for the rapid assembly of high-quality, compliant presentation assets for recurring meetings, grand rounds, or teaching sessions. You're not starting from scratch every single time, which is a massive time saver and ensures a consistent professional standard. It's like having a perfectly stocked surgical tray for your presentations.
And finally, a crucial practical tip about PowerPoint itself, its reliability, or lack thereof, for live presentations. It's often the last thing people think about, but it can be the first thing to go wrong.
This is a crucial yet tragically often overlooked point that can make or break a presentation. PowerPoint offers excellent file portability, but you cannot assume the Wi-Fi will be stable or that the conference computer will be up to date. Always, always save your presentation files to a flash drive, ideally too, as backups, and if possible, directly to the desktop of the room's computer before your audience even begins to arrive. This ensures absolute reliability, bypassing potential Wi-Fi dropouts, compatibility issues, or software glitches in conference settings. And critically, always remember to meticulously check the audio volume for any embedded video or audio clips. Being prepared for technical glitches is not just part of being polished, it's a testament to your professionalism. You should always have a plan B ready, even if it means being prepared to deliver your presentation gracefully without any slides whatsoever. Never just turn up with a single memory stick and hope it works out. That's a recipe for public anxiety.
Planning for every eventuality, a bit like a pre-op checklist for a major surgical procedure. That's an excellent reminder for preventing those last-minute tech panics. Moving on, we've talked about preparation and content delivery, but let's delve into the truly indispensable role of practice and polished delivery. So often, effective presenting is perceived as a natural gift, but you fundamentally say it's a learned skill akin to mastering a complex surgical technique.
Precisely. This is one of the biggest misconceptions. Effective presenting is most certainly not an innate talent bestowed upon a lucky few. It is a meticulously learned skill that demands unwavering commitment, consistent effort, and intentional, deliberate practice, just like mastering a new surgical technique, refining a diagnostic process, or perfecting a tricky clinical examination. I frequently recommend aiming for a dedication of 1 hour of preparation for every minute of presentation time. This might sound excessive, almost daunting, but figures throughout history, like Winston Churchill, famously employed this rigorous method to achieve their seemingly spontaneous, effortlessly brilliant delivery. It's about investing the necessary hours and effort behind the scenes to make it appear utterly effortless and natural when it truly counts, under the glare of the lights.
So a dress rehearsal isn't just for actors on a stage, it's for a consultant presenting grand rounds.
Not at all. It's absolutely critical for any presenter. You must conduct your rehearsals in conditions that are as close to the actual presentation environment as humanly possible. If you can, use the same physical setting, wear the same outfit you plan to wear, use the same technology you'll be using, and most crucially, present your entire talk out loud. What sounds perfectly fine, well-paced, and clear in the echo chamber of your own head may not translate well when spoken aloud. You'll catch awkward phrasing, notice where you rush, and identify points where clarity falters. Practicing verbally also profoundly aids memory retention, creating a deeper neural pathway for recall during the actual event.
And getting honest, constructive feedback from trusted peers, a mock audience, must be invaluable for ironing out those kinks before the main event.
It is invaluable, truly. Leveraging a mock audience, trusted colleagues, mentors, or even close friends who can provide honest, constructive feedback is absolutely critical. They can offer crucial, unbiased insights on the clarity of your data points, whether complex medical jargon is understandable to a broader audience, and your overall connection with the message. They might spot a distracting habit or a section where your enthusiasm wanes. It helps you preemptively identify and iron out any kinks, awkward phrasing, or confusing sections before the real event, saving you potential embarrassment and ensuring your message lands with maximum impact.
Is there such a thing as over-rehearsing? Can you cross a line where practice becomes detrimental?
There absolutely is, and finding that fine line is a nuanced art. Over-rehearsing can be just as detrimental, if not more so, than not preparing enough. Telltale signs include memorizing words verbatim instead of understanding and internalizing the underlying concepts. If you lose one word, your entire flow might collapse. You might start sounding robotic, utterly tied to the script, losing all spontaneity and genuine presence with your audience, whether they're real or imaginary during rehearsal. Another key sign is experiencing rehearsal fatigue. Remember, sleep is absolutely crucial for memory consolidation and for maintaining peak cognitive function. An exhausted presenter simply cannot possibly motivate or inspire an audience. The ultimate goal is to develop muscle memory for your presentation, where the delivery feels natural, conversational, and effortless, almost intuitive, rather than rigidly memorized. You want to know your material so well you can play with it, not be enslaved by it.
So practice makes it feel natural, not robotic, allowing for that fluid, engaging delivery. What about specific delivery techniques for high-impact medical communication? How do we cultivate authenticity, especially when nerves are high?
Authenticity is paramount. I encourage presenters to strive to be their maximum volume self. This isn't about speaking loudly in decibels, but about allowing your true personality, your genuine passion, and your unique quirks to drive the presentation. As a presenter, you should strive to say what you think with the passion with which you feel it. Don't try to be someone you're not. Own your unique way of explaining things, your natural gestures, your enthusiasm. Focus your energy and attention on the normal people in the audience, those who are genuinely open to your message, and consciously try not to waste energy on potential haters or overly critical individuals. Your genuine self, even with a few nerves, will always be more engaging than a manufactured persona.
And for cultivating confidence and a commanding presence in front of a medical audience.
Speak with unwavering authority, reflecting your true mastery of the subject matter. You're the expert in that room. If the setting is appropriate and space allows, incorporate natural movement around the presentation area. This can help burn off nervous energy and keep the audience visually engaged. Smile genuinely and maintain an engaged, interested facial expression. This subtle shift can lighten the energy in the room and help relax both you, the presenter, and your audience. And crucially, learn to embrace that initial rush of adrenaline. It's not fear, it's positive energy that can fuel and elevate your delivery. Channel it.
Eye contact is almost universally cited as crucial for connection. What's your specific advice there for medical context, perhaps from a large lecture hall to a patient bedside?
Eye contact is fundamental for building rapport and creating genuine connection with individuals. For a large audience, don't stare at just one person. Instead, establish initial contact with someone who appears interested or engaged. Then gradually, almost imperceptibly, sweep your gaze across different sections of the audience, making brief individual connections. For virtual presentations, the equivalent is looking directly into your camera, not at your screen. It gives the illusion of direct eye contact. In very dark auditoriums where you can't clearly see faces, subtly scanning different sections of the room creates the illusion of direct engagement. A good presenter, like a skilled clinician, never truly takes their hands off you or their eyes off the audience. It's a constant, gentle connection.
Voice modulation and strategic pauses, how do these play into maintaining engagement, especially when discussing dry clinical data?
Varying your speaking speed, your pitch, And your tone of voice makes your delivery infinitely more interesting and is critical for maintaining audience attention, preventing vocal monotony. Your natural accent is secondary to being clearly understood and engaging. Strategic use of pauses, however, is a true master technique. Pauses aren't just for catching your breath. They allow your audience precious time to process complex information. They give you time to compose your next thought without rushing, and they can make you appear more thoughtful, authoritative, and impressive. A well-placed pause can signal a transition to a new, important idea, or even subtly help you remember your next point without detection, giving you a moment to collect your thoughts. It adds gravitas and emphasis.
And body language. We know over 3/4 of communication is nonverbal.
That's right. Your body language is constantly communicating, often more loudly than your words. It must consistently reinforce your message, not contradict or distract from it. Encourage open, confident gestures that are natural to you. Allow for purposeful, natural movement within your presentation space. Actively avoid distracting habits like habitually crossed arms, which can signal defensiveness, hands constantly in your pockets or clasped behind your back, or excessive, nervous pacing. Furthermore, engaging in physical movement during your rehearsal process can actually aid memory recall, as there's a fascinating link between physical gestures, spoken words, and how the mind processes and stores information.
Finally, avoiding distractions from props and the crucial practice of arriving early.
These are simple, yet profoundly effective habits. Get into the routine of immediately putting down any tools, your laser pointer, a pen, a water bottle, when you're not actively using them. This prevents unintentional fiddling, frees your hands for more expressive gestures, and keeps the audience's focus squarely on you and your message. And arriving at least an hour, sometimes more, before your presentation is non-negotiable for serious medical talks. This generous buffer allows you ample time to set up your laptop, test all equipment, make friends with the AV staff, and rigorously verify that your slides, embedded videos, and audio all work exactly as expected. Crucially, it provides the mental space to develop a robust Plan B so you can deliver your presentation gracefully and confidently, even if unforeseen technical issues inevitably arise. You can never just turn up with a memory stick and simply hope it works out. Preparation is key.
That truly is like a pre-op checklist for a presentation, ensuring every variable is accounted for.
Exactly.
We've talked about preparation and delivery, but let's delve into mastering the virtual and high-stakes environment, which has become increasingly common and critical in the medical field. How do you assess the stakes to tailor your rehearsal time, especially for a new funding bid or a patient safety briefing?
It's absolutely crucial to meticulously determine the precise level of preparation needed for any given presentation. What constitutes high stakes in a medical context? It could range from a critical pitch for new, expensive equipment funding for a department, a presentation that will directly determine a major research grant for your team, addressing a hospital board during a crisis, or a crucial patient safety briefing where lives literally depend on clear, actionable information. Low stakes might be a routine departmental update or an informal teaching session. To accurately assess how much dedicated rehearsal time you truly need, ask yourself these concrete questions. Is this your first time presenting this specific material? Is the content itself relatively new to you? Are you feeling genuinely nervous about this particular audience or topic? Is the audience new to you, or are they known to be skeptical of your message? Is the presentation significantly longer than 20 minutes? The more yes answers you tally, the exponentially more rehearsal time you need to carve out. My motto is always, when in doubt, carve it out. It's an investment, not an expense.
That's a great principle. And for polishing presentations, specifically for executive medical audiences, hospital boards, trust executives, major research funders, time is often severely limited, so every word counts.
It is, and they operate on a fundamentally different cadence. Executives in healthcare leadership, whether hospital CEOs, trust board members, or major research funders, have intensely limited time, and their attention is a precious commodity. Your message to them must be ruthlessly streamlined, focusing sharply on its direct relevance to overarching organizational goals, measurable impacting significant improvements in patient outcomes, tangible cost savings, or clear competitive advantage. You must present clear, actionable recommendations and make explicit, specific requests. For high-level audiences, always start with the critical outcome or the impactful result. For instance, our new orthopedic pathway reduced patient recovery time by 25%, leading to X million pounds in savings and increasing our patient throughput. Provide only the bare essential details on your methodology or the intricate technical specifics, actively avoiding getting lost in the weeds. They trust you have done that work.
So, less methodology, more quantifiable results. And having an appendix of detailed information sounds like a clever, strategic way to handle probing questions without cluttering the main presentation.
Precisely. It's a sophisticated tool that allows you to confidently state, "Oh yes, I looked into that extensively," and the detailed breakdown of the statistical analysis is readily available in the appendix for your review if a senior leader asks a probing or highly technical question. This demonstrates a thoroughness and depth of preparation without overwhelming your primary streamlined message. A really powerful yet subtle technique is to keenly observe and then strategically incorporate the common phrases or even the nuanced slang used by senior leadership within your specific organization or industry. This subtly signals that you are in the same group, that you understand their strategic priorities and their lexicon, which significantly enhances your connection and, crucially, your credibility. Taking the time to research their technical backgrounds, their recent policy focuses, or their professional interests can profoundly inform your entire approach and make your message resonate deeply.
That's a powerful way to build connection and credibility. Finally, what about the crucial nuances of virtual medical presentations, which have become so prevalent and often feel quite different from presenting in person? Backgrounds, logos, camera angles, it all matters, doesn't it?
It absolutely does, and it can make or break your virtual impact. For virtual presentations, your physical background should be fairly plain, uncluttered, and professional. While some virtual templates might offer stark white, a slightly off-white or muted color for your actual presentation slides can be less visually fatiguing for your audience during a long meeting. Regarding organizational logos, while common practice, I advise prioritizing your audience's learning and engagement over being a purely marketing vehicle. Limit prominent logos to your first and last slide, or only if explicitly required and paid for, as they can be visually distracting and divert the attention from your core message.
And camera angle and lighting for maximum engagement. So many people get this wrong.
They do, and it has a profound impact on how you're perceived. It's absolutely crucial for maintaining virtual connection. Position your camera slightly higher than your eyes. This offers a more flattering and authoritative angle. Ensure you have good direct lighting, like a ring light or natural light coming from in front of you, to avoid distracting shadows and ensure your face and upper torso are clearly visible for hand gestures. While blurring backgrounds is popular, it can actually disengage the audience when you move, as parts of you might disappear or become fuzzy, making you appear as just a talking head. A static professional background is often better.
And what about clothing choices for virtual settings?
Simple rule. Advise wearing plain, block colors rather than busy or heavy patterns. Complex patterns can create a visual moi effect on camera, making you appear to visually blur into the background and further reducing your impact to just a disembodied voice. Simple, strong colors ensure you remain clearly visible and professional.
And for actively engaging the virtual audience, beyond just speaking at them.
Specific strategies are key. If possible, have someone dedicated to managing the chat box to encourage participation and quickly answer technical questions. Send digital copies of your slides or any supporting documents in advance, allowing the audience to reference them during your talk. And finally, utilize screen share effectively and dynamically by changing views. Frequently shift to full-screen visuals when discussing key diagrams or images, then back to your webcam view for direct connection during Q&A. This fluidity keeps the audience's attention actively on the most important visual element at any given moment, making the virtual experience far more engaging.
So what have we unpacked today? We've explored how truly impactful presentations in medicine are far from an innate talent. They're a truly learned skill, a commitment that, when invested in, pays profound dividends. It's about meticulously transforming your complex medical message into a captivating story that resonates, designing visuals that not only illustrate but also profoundly enhance understanding and retention, and then delivering with a polish and confidence that comes directly from purposeful, deliberate practice, not from some mythical innate ability.
Indeed. In an era of escalating information overload and increasingly complex medical advancements, your ability to distill that inherent complexity into compelling, actionable, and memorable insights is not merely a soft skill to be casually dismissed. It is, in fact, a powerful act of patient care, a catalyst for scientific advancement, and a cornerstone of your professional influence and leadership within the medical community.
How will you ignite that fire, spark that change, and leave that lasting impact in your very next presentation? If you found this deep dive valuable, please consider leaving us a rating and sharing it with a colleague who might truly benefit from these insights. Thank you for joining us on the Deep Dive. Until next time, keep informing, inspiring, and transforming.